Senator Roberts.
Thank you, Chair, and thank you for appearing today. If I've got time, I'll ask questions of the Heart Foundation, but I want to start with Dr. Shand, or Professor Shand, I'm sorry. Part of understanding something statistically is to ask questions and to listen to people outside the normal data capture. I had a conversation with an insurance broker who's got clients all over the country in many industries, many professions, including medical professionals. And I'll go through these points that I wrote down as a result of that conversation, Professor Shand, and ask you a question. He says that he has been swamped in claims for income protection since mid-2021, which was after the COVID injections were released, before COVID was a big part of the community. Cancer, heart attacks and disease, strokes, long-term musculoskeletal injuries, especially hands and arms, new cancers, recurrence of cancers, eyesight. He believes now, and he's been talking to other brokers, they believe that the industry is unsustainable. Premiums are increasing dramatically because claims are increasing. Cost of living is increasing, and insurance is less of a factor in people's spending of their income. Industry-wide pricing was repriced in 2023. Income protection went up 20%, life insurance went up 10%. More increases are coming in 2025. They've been foreshadowed. The industry knows it is under stress. The claims departments are telling him they're under pressure. He's also talked to some of the professionals, including doctors. The doctors are scared. They did what they were told rather than what they disobeyed their training. They're not very comfortable. It's led to specialists being run off their feet because of the injuries and diseases. Mental health, he said, has now become a really big problem, which would be something you would back up, wouldn't it?
Would I back up that mental health has become a really big problem?
Yeah, there's a delay in getting in. They're overworked now, mental health professionals.
Yeah, yeah, but I don't think that's a short-term thing. I think that's been a trend that's perhaps been exacerbated by the pandemic, not necessarily caused only by the pandemic.
Okay, thank you. He says there's been a steep increase in claims, mental health claims, since mid-2021, and especially the last 3 years, which brings us to now. So let's move on to the Heart Foundation. If you go to your submission, page 4, bullet point number 6, you say the Australian population, especially individuals with cardiovascular disease, should be encouraged to stay up to date with their COVID-19 vaccinations. And if you go to page 15, under 6.2, second paragraph, furthermore, based on the risks of a COVID-19 infection on individuals with cardiovascular disease, the Heart Foundation also recommends the Australian population stays up to date with their COVID-19 vaccinations. Could you tell me on what scientific or medical basis that those recommendations are made, please?
I'll start, and Dr Doherty would. The one thing that's clear from post-vaccination is that the severity of COVID infections is reduced. We're seeing fewer hospitalisations per 1,000 people, or however you want to quote it.
Excuse me, which data are you relying on there?
What data?
If you could get it to us on a question on notice, just tell us the basis of that. Your source of that data?
Of course, I can also justify it on the basis of my own clinical experience.
But I would like the data as well,
okay,
please.
We can do that. Do you want to speak to that?
We can take that on notice to provide you with the data.
That's fine, yep.
In regards to vaccinations, there's a correlation between the severity of COVID-19 and the impacts that it can have on the cardiovascular system. When you have a vaccination, it can reduce that severity. We also follow the guidance.
Could we have the source of that data as well, please?
Yes, I can provide that on
Thank
notice.
you.
We also follow the guidance of the Department of Health. So we believe in that organisation, we trust their word, so we will also follow their guidance.
Okay, thank you.
Just to add also, we would make a similar recommendation about influenza vaccination and other respiratory viruses, because we know that vulnerable people with heart disease don't have the resilience to cope with any kind of respiratory condition that other people of good health do.
Thank you. Do you have any peer-reviewed papers with data backing that up?
Plenty.
Okay, could we have some, please? Thank you. On page 7 of your submission, there's a graph, figure 3, which shows a reduction in the average age standardised mortality decreasing from, in 2021-2023, decreasing from 2015 to 2020. Are you aware of the change in baseline from the ABS, Australian Bureau of Statistics?
So the baseline in the crude data or the age standardised?
Both.
So there is a change from baseline. There is an excess deaths during the COVID times. But with this graph, what we're trying to show is that there's we need to look at age standardised mortality. So that takes into account the ageing population, and it's comparing like with like. So one of the terms of reference was to compare the mortality rates from previous years to during COVID. And this graph, figure 3, shows that there's actually a decline. There was some previous years where there was excess mortality due to the influenza virus. So it's not an isolated event to occur during COVID-19 pandemic that there are increased deaths compared to what is considered baseline.
Have you assessed the impact of changing the baseline?
No, not personally.
Okay, thank you. Okay, on page 8 of your submission, section 4.1, deaths caused by COVID-19 and the pandemic state of emergency, and I emphasise and. You said in your second paragraph below that subheading, additionally, the pandemic's impact extended beyond just respiratory illness. For example, during that statement there, you said these included diabetes went up 96%, heart disease 89%, Alzheimer's disease 64%, cerebrovascular diseases 35%. New York City experienced the largest increases in non-respiratory deaths, notably those due to heart disease 398% and diabetes 356%. Is there any explanation of them?
So that data is looking at United States data.
Yeah.
So in regards to the explanation, did you want...
I just wanted an explanation.
So this particular study was looking at the particular areas with the highest prevalence of COVID-19 and showing the correlation between the increased deaths for these other chronic conditions. So the point we were making with this paragraph was in areas where there is high prevalence of COVID, there's more likely that people will die from preventable chronic conditions.
Thank you. Thanks, Chair.